السلام عليكم. محاضرتنا اليوم عن ال gastrointestinal infections, basically عن الدياريا. There are three clinical types of diarrhea. Here the acute water diarrhea that lasts several hours or days and include cholera, and acute blood diarrhea, also called dysentery, and persistent diarrhea that lasts for 14 days or sometimes longer. And the causes of diarrhea. The causes of diarrhea generally the infectious causes, 90% of the infectious causes are because of viral agents. We have non-infectious causes. Non-infectious causes includes adverse effect of medications, toxin ingestion, ischemia to the bowel, and other causes. Clinically, we have diarrhea plus vomiting. This is mainly caused by Staphylococcus aureus, Bacillus cereus, and the virus Norwalk virus. We have also water diarrhea, usually caused by Clostridium perfringens or Enterotoxin-Mediated E. coli or a virus. Also, we have inflammatory diarrhea, which is associated with pain and fever, usually caused by Campylobacter species Salmonella, enterohemorrhagic E. coli, and Shigella. The first three usually causes bloody dysentery. In addition to some of the diarrheal illnesses are associated with systemic symptoms produced by those pathogens. Systemic symptoms include reactive arthritis. Also, patients have arthritis, urethritis, and conjunctivitis. Usually, these caused by Salmonella species, Campylobacter species, Shigella species, and Yersinia. Also, hemolytic uremic syndrome, when the patient develops hemolysis and anemia, which is a critical case, usually caused by E. coli 015787 or Shigella toxin. Both of them may have Shigella toxin. Diarrhea also uh, diarrhea also evaluation of diarrhea when we need for workup or to further investigating the etiological agent. I mean, we need to investigate the cause of infection. In mild diarrhea, no workup is necessary, and no need for diagnosis of the exact to identify the exact the pathogen that's causing the diarrhea. But if the diarrhea persists more than 14 days, it will need further evaluation. There are alarm signs. These alarm signs, if present, it needs further evaluation. Examples of alarm signs are severe dehydration, presence of blood stool, the fever rise above 38.5 degrees Celsius, history of antibiotic use, abdominal pain in patients above 50 years old, or the patient is immunocompromised. History evaluation of diarrhea, the most important part of the evaluation of diarrhea is taking history. Why history is important? Because a lot of tests are available. History gives a clue about what pathogen is involved. Because if you expect the pathogen, you can choose the appropriate test to identify this pathogen. So a complete history should be taken. The important point in history is the food eaten recently, exposure to ill patient, recent travels, medicinal history, and underlying illnesses. Diarrhea may be caused by virus, bacteria, parasites, food poisoning, or non-infectious agents. And the causative agent for diarrhea usually acquired by ingesting contaminated food or beverage. The mechanism in inflammatory gastroenteritis uh, uh, involve bacterial invasion or cytotoxin causes mucosal damage that leads to inflammation. Mechanism of invasive gastroenteritis involve bacterial penetrate the mucosa and invade the reticuloendothelial system. The classical pathogens causing secretory gastroenteritis includes Vibrio cholera, Enterotoxin E. coli, Clostridium perfringens, Bacillus cereus, Staphylococcus aureus. While the classical pathogens of inflammatory gastroenteritis include Shigella, Salmonella, typhi, and Vibrio parahemolyticus, Clostridium difficile, and Campylobacter. The classical pathogen of invasive gastroenteritis includes Salmonella typhi or paratyphi and Yersinia enterocolitica. So, then, for microorganisms to cause diarrhea, first microorganism must be able to survive the gastric acids in order to reach the small bowel. In the small bowel, motility, the peristalsis motility, is a major host defense, so organism cannot adhere to intestinal wall. Generally, a large dose of microorganism is needed to cause the disease, but this differ between pathogens and according to the type of pathogen. A number of ingested microorganisms, we have the median infectious dose, which means the number of ingested organisms that must be ingested to cause diarrheal illness in 50% of the exposed individual. Also, the risk So the risk factor for diarrhea includes the number of ingested organisms, alcohol which is adequate stomach acidity, sorry, reduction in normal flora because the use of antibiotics, broad spectrum antibiotics. So we have enterotoxin-mediated diarrhea, start with enterotoxin-mediated diarrhea. So we have rapid onset of in enterotoxin-mediated diarrhea, we have rapid onset of symptoms that symptoms develop in less than 12 hours. We don't have fever, there's no fever, absence of blood or pus. This point to enterotoxin-mediated illness if there is diarrhea, no blood or pus, and no fever, and very rapid after exposure to the pathogen, it may indicate that there is enterotoxin-mediated illness. Also, the large number of water stools, sometimes more than 20 liters per day, 20 times per day. The enterotoxin-mediated diarrheal pathogen, the classical pathogen that causes enterotoxin-mediated diarrhea, includes Enterotoxin E. coli, Vibrio cholera, Staphylococcus aureus, Clostridium perfringens, and Bacillus cereus. Other types that may cause enterotoxin-mediated diarrhea, like viral parasitic, can be similar, but symptoms longer lasting. In invasive diarrhea, there is invasion of the bowel mucosal surface, and symptoms include fecal leukocytes, RBC, sometimes fever. Classical organism causing invasive diarrhea include Salmonella species, Campylobacter species, Shigella, E. coli, and Invasive Diarrhea, which is a protozoan parasite. These are the common pathogen involved in diarrhea. You can see The first bacterial we discuss here is the Campylobacter jejuni, which is the most common cause of bacterial diarrhea in the world, transmitted through inadequately cooked poultry or untreated water, unpasteurized milk, and the exposure to animal with diarrhea. The diarrhea caused by Campylobacter jejuni usually characterized by being self-limited, and so antibiotic not need to be used. The main manifestation of diarrhea caused by Campylobacter jejuni includes fever, diarrhea, and abdominal cramp. The characteristic of the Campylobacter jejuni bacteria grows best at 42 degrees Celsius. It is microaerophilic conditioned for culturing. It means it needs little oxygen. Capnophilic, it likes CO2 for growth. One of the methods to identify culture identification of this microorganism is called the Campy plate. The shape of the microorganism is gram-negative curved rods, described as seagull wings. Campylobacter, there are 13 species have been associated with human disease, including Campylobacter jejuni, Campylobacter coli, and Campylobacter absaliensis. These are the most common causes of Campylobacter gastroenteritis. Indeed, a variety of animals serve as a reservoir, and humans acquire Campylobacter jejuni and Campylobacter coli infection through the consumption of contaminated poultry, milk, and other foods. Campylobacter jejuni produce histologic damage to the mucosal surface of the small intestine and large intestine through the invasion into the intestine. Campylobacterial do not have well-known toxins that play a role in the pathogenesis, but adhesins, cytotoxins, and enterotoxins are detected in Campylobacter jejuni as isolates, but their exact role are not well defined. Sometimes the Campylobacter infection associated with an autoimmune disorder called Guillain-Barré syndrome. Here we see that Campylobacter jejuni and Campylobacter absalinensis infection have been rarely associated with Guillain-Barré syndrome. This is a disorder of the peripheral nervous system characterized by development of asymmetrical weakness. The pathogenesis of this disease is believed to be related to antigenic cross-reactivity between the oligosaccharides of Campylobacter and glycosphingolipids present in neural tissues. The second common bacterial agent causing diarrhea is the Salmonella species. There are many species belong to Salmonella. Some of the species of Salmonella cause gastroenteritis and food poisoning. These are contracted and transmitted, contracted by eating undercooked meat or poultry, eggs, and contaminated dairy products. The main symptoms associated with gastroenteritis and food poisoning caused by Salmonella includes nausea, vomiting, and diarrhea, which develops 6 or to 48 hours after the ingestion of the food. Usually, the illness usually is self-limiting. Antibiotic is discouraged because they can induce carrier state. So it's better to left to untreated with antibiotics and treated by conservative treatment. The other type of infection caused by Salmonella species is the enteric fever. Enteric fever or typhoid fever is the most severe, transmitted from contaminated food and water. In the enteric fever, organism invade the small bowel and colonic tissue. Then the microorganism live and reproduce in monocytes in the reticuloendothelial system. The microorganism can also can invade gallbladder and produce carrier state. Gallbladder or not carrier state because there is low blood supply, so bacteria can live there in the gallbladder. Symptoms of enteric fever includes headache, fever, malaise, and abdominal. Uh, to describe Salmonella species, these infection usually require a high microbial load for infection. In culture, when we culture this microorganism on culture media, usually we look for lactose, non-fermented colonies, and maconchi agar, on hink, on Hinkton enteric agar, we look for blue, green colonies with black centers. On XLD, we look for red colonies with black centers. When we examine the stool, we look for fecal white blood cells. So we can see white blood cells and RBCs in the stool. The salmonella colonies growing on Hickton enteric agar. So the salmonella is gram-negative bacilli that have more than 2,400 unique serogrows, but are broadly classified into typhoidal species that include Salmonella typhi and paratyphi, and non-typhoidal species, which are Salmonella enteritidis and Salmonella typhimura, are the most common isolates. Salmonella typhi and paratyphi have no reservoir other than humans and can cause disease with a very low inoculum. Salmonella typhi produce a febrile illness called the typhoid fever. After passing through the intestinal cell lining, Salmonella typhi is engulfed by macrophage, where it is able to replicate and get transported to the liver, spleen, and bone marrow. After 5 to 25 days, what occurs? The patient experiences a fever with headache, malaise, myalgias, and salmon pick rash on the abdomen. Severe manifestations such as sepsis and intestinal bleeding may also develop. For Salmonella enteritidis, these bacteria colonize the gastrointestinal tract of virtually all animals. So this infection with Salmonella enteritidis requires large inoculum for the development of this symptomatic disease. Therefore, infection in humans usually occurs when contaminated foods are improperly stored or left at room temperature, allowing the bacteria to replicate. The infectious dose of Salmonella enteritidis, however, is lower in certain high-risk populations, such as the elderly, immunosuppressed, or HIV infected. This Salmonella enteritidis infection is characterized by fever, nausea, vomiting, bloody or non-bloody diarrhea, and abdominal. For the third microorganism causing diarrhea discussed in this lecture is the Shigella species. Shigella species may cause diarrhea that may have blood and pus. Usually, symptoms appear or develop 12 to 50 hours after exposure. The Shigella species or Shigillosis, or sometimes called bacillary diarrhea, is the most communicable form of the diarrheal bacteria. Symptoms of shigellosis or this type of diarrhea include fever, malaise, fatigue, and anorexia. Fast fact or the characteristic of Shigella species require low microbial load. In examining the stool, we can see fecal white blood cells. Also, we observe blood and pus. On culture, we see colorless colonies on maconchi. We see blue-green colonies on Hinkton enteric agar. On XLD, we see red or colorless colonies. This is the example of Shigella. So, Shigella, indeed, here the gram-negative bacilli is member of the Enterobacteriaceae family. Shigella have these bacilli have four recognized species, which are Shigella sonnae, and Shigella flexneri, Shigella dysentery, and Shigella bodii. Shigella sonnae enteritis occurs predominantly in industrialized countries, in European countries mainly, while Shigella flexneri occurs in developing countries such as Iraq and other countries in the region. Shigella dysentery results in the most severe infections, but Shigella bodii is infrequently isolated. Humans are only known reservoir for Shigella. Shigellosis is transmitted by fecal oral route, primarily by people with contaminated hands, and less commonly through contaminated water or food. Because only a small inoculum is necessary to establish the disease, less than 200 bacilli are required. Shigellosis spread rapidly in institutions such as daycare and custodial institutions, or sometimes in communities where there are poor sanitary standards. Shigella, the pathogens of Shigella invades and replicates in cells lining the colonic mucosa, resulting in symptoms ranging from mild gastroenteritis to dysentery. Symptoms include abdominal pain, small and frequent bowel movements, stool with the blood or mucosa. Regarding toxin produced by Shigella, Shigella dysentery produce an enterotoxin. Enterotoxin, it means toxin that affect the enterocytes. So the Shigella dysentery produce an enterotoxin, which is shigatoxin. Shigatoxin disrupt protein synthesis in the enterocytes and produce endothelial damage. For E. coli, we know that E. coli is part of normal flora, or what's called microbiota. But there are the orogenic Escherichia coli strains. So, E. coli is a gram-negative bacillus and facultative anaerobe. The strains of E. coli that causes gastroenteritis are divided into the following six groups. We have enterotoxigenic E. coli that cause of traveler's diarrhea, enteroinvasive E. coli, enteropathogenic E. coli that cause diarrheal outbreaks in infants in hospital settings. We have enterohemorrhagic E. coli that contain the important strain of E. coli described as 015787. This characterized by presence of Shigella-like toxin and usually associated with hemolytic uremic syndrome. We have enteroaggregative E. coli that cause chronic diarrhea in HIV patients, travelers, and children in poor countries. Also, we have diffusely adhered E. coli. The clinical spectrum of diarrheal disease caused by these strains is dependent upon the characteristic of the secreted enterotoxin and according to the plasmid-mediated virulence factors that allows for attachment and invasion of the intestinal epithelium. Usually, enterotoxigenic E. coli produce heat labile and heat stable enterotoxin, which affect the small intestine and cause secretory diarrhea. Enterohemorrhagic E. coli produce cytotoxin, shigatoxin, that destroy intestinal villi and may cause dysentery. Enteropathogenic E. coli cause diarrhea by destroying the microvilli in the small intestine, while enteroinvasive E. coli causes bloody diarrhea by causing destruction of the epithelial cells in the large intestine. The diseases caused by enterotoxigenic E. coli and enteropathogenic E. coli are seen most commonly in developing countries, occurring mostly in infants. There are a syndrome, which is the hemolytic syndrome. This is a disorder characterized by acute renal failure, thrombocytopenia, and microangiopathic hemolytic anemia. It is a complication of enterohemorrhagic E. coli infection. Usually, the strain produce Shigella toxin that occurs in about 10% of the infected children under the age of 10. Death can occur in 3 to 5% of children with hemolytic uremic syndrome, and severe neurological and renal sequelae can occur in as many as 30% of the patients. This is E. coli. The the fourth uh, bacterial causes of diarrhea is the Vibrio species. The Vibrio to cause infection require a large microbial load. This bacteria grow on TCBS, which is media, which is the thiosulfate, citrate, bile salt, saccharose, agar. In this media, there are substances that inhibit the growth of colonic flora. Also, the substances differentiate saccharose fermenters from species of Vibrio that are non-fermenter. So the other species ferment saccharose, but the Vibrio cannot ferment saccharose. So it differentiates Vibrio from other species in the intestine. In examining the stool of patient suffering from Vibrio cholera infection, the stool contains no RBCs or white blood cells, since it is a toxin-mediated and non-inflammatory. There's no inflammation, no invasion. Vibrio are gram-negative bacilli that grow naturally in estuarine and marine environments worldwide. It means present in the aquatic, in the water-based environments, and can survive in contaminated waters with increased salinity, so in the sea, in the oceans, and the temperature up to 37 degrees centigrade. There are 12 species of Vibrio that have been implicated in human infections. The most prominent species being Vibrio cholera, Vibrio parahemolyticus, and Vibrio vulnificus. For Vibrio cholera, the etiological agent of cholera, the well-known disease cholera, it is subclassified based upon the somatic antigen or somatic O antigen. So we have Vibrio cholera O1 and Vibrio cholera O139. Both of them are responsible for causing classic cholera, which can occur in epidemics or worldwide pandemic. Clinical manifestation of cholera range from asymptomatic colonization to severe, rapidly fatal diarrhea that begins 2 to 3 days after ingestion of the bacilli. The fluid loss from cholera, which is this is the important point, fluid loss from cholera can be profound, very huge, and result in severe dehydration and metabolic acidosis due to bicarbonate loss, hypokalemia, which is the loss of low levels of serum potassium, and hypovolemic shock. If left untreated, the mortality rate is high, is up to 60%, but the mortality rate is less than 1% in those who are promptly treated with the replacement of lost fluid and electrolytes. Non-Vibrio cholera species such as Vibrio parahemolyticus can be transmitted through contaminated shellfish and cause mild to severe secretory diarrhea. Sorry. Clostridium difficile is a hospital acquired due to alteration of normal flora due to the use of antibiotics, broad spectrum antibiotics for extended periods. In diagnosing the Clostridium difficile associated diarrhea or antibiotic associated diarrhea, we test for toxins. Culture not usually performed. There is this bacteria produce toxin. Toxin consists of toxin A and B that responsible for the infection. Less common agents of GI illness include Yersinia enterocolitica, Pseudomonas shigelloides, Aeromonas hydrophila, and Listeria monocytogenes. These four bacteria may cause diarrhea, but less common than other causes of diarrhea that mentioned before in this lecture. Uh, Sometimes not the bacteria itself cause the illness, but the toxin present in the food can cause the illness. This is called food poisoning. So the food poisoning caused by toxin-produced bacteria. Here, the bacteria may no longer be alive. Bacteria may be killed during the cooking or any processing of the food, but the toxin can cause food poisoning. Example is Staphylococcus aureus, Clostridium botulinum, Bacillus cereus. You see here that in the S. aureus associated food poisoning, the source of contamination is the nasal passages of asymptomatic carriers, people who working with food processing or food preparation or processing. The toxin is the staphylococcal enterotoxin, again, toxin that work on enterocytes, we call it enterotoxin. Implicated food that may be associated with enterotoxin, Staphylococcus enterotoxin food. These foods include the mayonnaise, eggs, dairy products, canned food, frozen food, or processed meats. In Clostridium botulinum associated food poisoning, the source of contamination is soil and water. These microorganisms produce botulism neurotoxin. It's a neurotoxin. It means you work on neural cells. The food implicated is mushroom, salami, improperly canned food. For Bacillus cereus, the source of contamination is the environmental contaminants. The toxin produce heat-stable enterotoxin and heat-labile enterotoxins. Usually, the food implicated is grains, especially rice. Usually it's hard to diagnose the viral cause of diarrhea. We have many viral causes of diarrhea, but usually it's hard to diagnose the diarrhea using the classical method due to the virus size. Viral cannot be seen by compound microscopes. It needs to be seen by electron microscope or by PCR or sometimes by use of cell culture. Among the viral causes of diarrhea is rotavirus. Rotavirus is the primary cause of diarrhea in children below 5 years of old. It's spread by fecal oral route. The peak incidence is from December through June. Have calicivirus such as norovirus. This virus spread by fecal oral route by contaminated food or water or environmental vomits. Also can be transmitted from person to person. This viral cause what's called stomach flu. Uh, for laboratory diagnosis of gastrointestinal pathogens, if specimen collected and handling is the most important part of the workup or the diagnosis of laboratory diagnosis, sorry, of the diarrheal cause of the cause of diarrhea. So first, we collect the specimen within 4 days of the onset of symptoms. Stool should be processed as soon as possible, not refrigerated. Rectal swabs not recommended. Use of preservatives not recommended. So it should be the stool should be examined within a short period, usually within 30 minutes of receiving the specimen in the laboratory. We can examine the general, or we can do the general stool examination in which we look for fecal leukocytes. So indirect microscopical examination almost exclusively preferred to detect the presence of white blood cells or RBCs. Their presence is due to the intestinal wall bleeding. Also, we differentiate invasive disease from toxin-mediated illness, viral illness, and parasitic infections by being yeah, by finding fecal leukocyte. This is fecal type of fecal leukocyte. We do culturing, or usually we do culturing of stools. Sometimes, if recommended or if required by the physician, the laboratory may do culture. All media plates work together to determine the presence of the pathogen. So routine stool culture include testing for Salmonella species, Shigella species, Aeromonas species, Blizziomonas species, and Campylobacter jejuni. Less frequently ordered Yersinia, Viverio, E. coli 015787. Identification and reporting of the isolates. How to identify? First, there are tests that commonly used to identify the causative agent. We use what's called the presumptive identification test, such as oxidase. The test is important in identifying the microorganism. TSI urea also used. How to report the results? If no pathogens found, we usually report no Salmonella, Shigella, or Campylobacter isolated. Pathogen isolated need identification and quantification. Sometimes any amount is significant. Additional testing may be the microorganism.